Did you know that there's a breast implant that never stops growing? Well, it is true. I'm a real plastic surgeon, and on this video, we're going to count down 5 of the biggest secrets about your breasts that plastic surgeons may not want you to know. Have you ever seen photographs of women from the 1980s and 1990s with incredibly, impossibly large breasts? Well, back then there was a procedure called the string breast augmentation, and this was a certain type of a breast implant that was invented by a doctor named Gerald Johnson. Now, he was a plastic surgeon in Texas who created the string breast implant. It's made of polypropylene string that is inserted into the breasts, and these strings literally absorbed moisture from the body. By absorbing moisture or water, it basically made the breast grow. The problem with these implants is that they would not ever stop growing. People would have these string implants placed into them, and the breasts would just keep getting bigger and bigger and bigger and bigger. Now, the crazy thing is that these breasts would get so big that the skin and the subcutaneous fat around them would get thinner and thinner and thinner and could even actually pop. So the way that women got around these breasts getting so huge and literally popping is that they would stick a needle into them and actually pull the fluid out. And this would need to be done at frequent intervals in order to prevent the breast from getting exceedingly large. Now, the good news is that the FDA did outlaw these implants back in 2001, and they really haven't been used much since then, except on the black market and in some other countries. So if you're thinking about getting your breasts bigger and somebody offers you string breast implants, run away. So how do some of the women that you may see on social media today get impossibly large breasts if they don't have string implants? Well, the largest breast implants being made currently are about 800 cc's. And if you think about like a 2-liter bottle of soda pop, that's 2,000 cc's. So we're talking less than half of that. And although an 800 cc implant is large, it's not going to give you breasts like the people you see in these pictures. So I know you're asking me, Dr. Youn, then how does a woman today get breasts that are this huge if they're not natural? And the way some women are doing it is they're actually doing it themselves. It is crazy. Women are having plastic surgeons place tissue expanders into their breasts. Tissue expanders are basically temporary implants that can be filled through a valve on the surface of them. Now, this is an example of a real tissue expander. So you put the expander into a breast, and this actually is a fill port. So if you take a needle and you stick it into the fill port and you actually start injecting fluid into it, it can cause the expander to get bigger and bigger. Now, this is not a big expander. This is maybe a 250 or 300 cc expander, but they make them as big as 850 cc's, which once again, I mentioned 800 cc's is big, but it's not massive like you may see. So the way that these women are getting around it is that they are overfilling their expanders to huge proportions. They're filling them to 2,000 cc's or more because these expanders are essentially made of silicone rubber and they do expand.
You're going to need a bigger boat.
The problem is you get that much saline into an expander and it's going to get weaker and weaker as you get it bigger and bigger, and it can also pop. As we saw very recently with the social media star Mary Magdalene, where one of her implants popped.
Yeah, basically my breast implant popped again, and I am having surgery to take them out next week. I am going to go back natural.
So needless to say, do not make your breasts larger by doing it yourself. If you're thinking about larger breasts, consult with a real board certified plastic surgeon and try to stop at that 800 cc mark. Several years ago, I went public with my belief that breast implants may make some women sick. And unfortunately, at the time, the dogma, the belief around really all plastic surgeons for the most part, was that implants were completely safe and that women do not get sick from breast implants. And if they did get sick from breast implants, it was either in their head or from something else. In fact, I know of patients of mine who've seen other plastic surgeons in my area and said that they thought their implants were making them sick. And you know what some of these plastic surgeons did? They told them to go see a psychiatrist. So this is a very controversial topic in plastic surgery, but the tide is shifting. There are now a lot of plastic surgeons who have gone public with agreeing with me that breast implants may make certain women sick. And we are getting more and more data showing that this is most likely the case. Currently, there are tens of thousands of women who have gone online to share their stories about symptoms that they believe are associated with their breast implants. And these are symptoms like hair loss, fatigue, unexplained rashes, brain fog, muscle aches, and joint pain. And there are some small studies that do show that there may be a link between breast implant illness symptoms and silicone breast implants. Although I do need to say that the science does not show that this is limited to just silicone implants. A lot of plastic surgeons like myself are seeing patients who have saline implants, which do have a silicone rubber shell around them, also appear to have breast implant illness symptoms. And studies are showing that about 55 to 85% of women who have their implants removed when they have breast implant illness symptoms do appear to get significantly better. Well, there are studies going on as we speak about breast implant illness for us to learn more about them, and so I'm excited to show you those studies as they come out and share that data with you. In the meantime, I think it's important to realize that this is not something that happens in everybody who gets breast implants. The satisfaction rate for breast implants is 95% or more, but I think it is something that anybody who's considering implants or who has implants really needs to know about. Have you ever thought about taking a collagen supplement, but weren't sure about whether they actually worked to support your health and improve the appearance of your skin? Collagen is the building block of our skin, and one reason why our skin ages is due to loss of collagen. A recent meta-analysis of over 1,100 participants found that taking a daily hydrolyzed collagen supplement improved the appearance of aging of the skin. And it did this by reducing wrinkles and improving skin elasticity and hydration. For this reason, I believe that taking a daily collagen supplement is a great way to support your skin's appearance and its health. And my favorite one is my Youn Health Supplemental Collagen. It's taste-free and easily dissolves into your hot coffee or tea. I like to mix it with smoothies or into my acai bowl. Check it out at younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'm so certain that you'll love my Youn Health Supplemental Collagen that we have a money-back guarantee. While BII is controversial and some doctors don't believe in it, this is not. This is 100% true. Certain breast implants do increase your risk of a rare type of cancer in the scar tissue surrounding them. Now, every breast implant that we place into a patient gets surrounded by a pocket of scar tissue, and it's called the capsule. Several years ago, we discovered a rare type of lymphoma called anaplastic large cell lymphoma in the scar tissue surrounding certain types of breast implants in a small percentage of people. As of last year, there were confirmed 1,130 cases worldwide of breast implant-associated ALCL and 411 cases in the United States. And the interesting thing is it appears to be mainly due to the interactions of a textured breast implant shell and the scar tissue surrounding it. Today, there's not a single case of a woman getting breast implant-associated anaplastic large cell lymphoma from a solely smooth-walled implant. It's all the textured or sandpapery surfaced implants that appear to be causing or related to this cancer. Now, we don't know exactly why this happens, although there are some hypotheses regarding biofilm formation, or basically bacteria that grows on the surface of implants. And because of this finding, the Allergan textured breast implants have been taken off the market. And I also need to let you know that recently we discovered 19 cases in our scientific literature of squamous cell carcinoma in the capsule or that scar tissue surrounding breast implants. The average time from augmentation or implantation and the cancer being found is 22 years. And we don't have a whole lot of data on squamous cell carcinoma surrounding breast implants, but this is something that, once again, if you're thinking about breast implants, you do need to know about. Plastic surgeons all across the country and all around the world are offering fat grafting as an alternative to breast implants for their patients for a cosmetic breast augmentation. And this operation, where essentially you liposuction fat from the hips or the thighs or the tummy, you purify that fat and then inject it into the breasts, that operation overall can be done very, very safely. But I'm not a big fan of this surgery for reasons that really plastic surgeons are not talking about. Many years ago, we discovered that our fat is chock full of stem cells, and doctors are now using fat as a stem cell donor site to conduct studies. Well, we know that 1 out of 9 women will get breast cancer in their lifetimes, and so women's breasts are definitely a cancer-prone organ, unfortunately. So the question that I have is, what happens when you take a bunch of fat that is chock full of stem cells and you inject it into a woman's breasts? Does that impact the possibility that they may get breast cancer sometime in the future? So theoretically, let's say you have a woman who's 35 years old, she's thinking about breast enhancement, her plastic surgeon says, hey, let's do it using your own fat. Well, unbeknownst to the plastic surgeon and the patient, what if she has just a small cluster of dysplastic or abnormally growing types of cancerous cells in her breasts? And this cluster of cancer cells is so small and so non-aggressive that it would never truly become a cancer until, let's say, that woman turned 140 years old. So theoretically, what would happen then if you inject a bunch of stem cells around that cluster of dysplastic or potentially cancerous cells? Is it possible that it could cause then that tiny cluster of cancerous type cells to grow much more quickly, and maybe this patient gets a breast cancer when she turns 60 instead of 140? So these are theoretical things that definitely concern me when you consider injecting fat into a woman's breast, especially if you're just doing it in a cosmetic basis. And I brought this question up to many prominent cosmetic plastic surgeons, and nobody really has a good answer to it. And the reason why is because it's never truly been studied, because we haven't followed women out far enough to know whether something like this may happen. So if you're thinking about fat grafting to your breasts as a cosmetic procedure, I just want to make sure that you're knowledgeable about this potential risk, because it's very possible your doctor is not talking to you about it. Now, earlier in this video, I mentioned to you string implants and that there are women with these implants where their breasts don't stop growing. Well, I recently reacted to a video of a woman who still has string implants in one of her breasts. And her story is quite frightening, but it's very educational. Take a peek at it right up here in this video. I think you're going to find it very eye-opening. And remember, eat real food, use clean skincare, and always wait before you operate.